Hey everyone, welcome to Heart Health with Michelle, my YouTube channel. So happy that you're here. Today I want to talk about stroke and how it's related to heart disease and what we can do about it. Before we begin, I just wanted to welcome everyone to my YouTube channel. Thank you for being here, and also to just let you know a little bit more of who I am for those of you who are just finding my page. My name is Michelle Rothenstein. I'm a registered dietitian nutritionist who specializes in heart disease prevention and management through science-based nutrition. I want to give you an empowered approach so that you can reduce your risk of cardiovascular disease and its complications. Whether this is primary or secondary prevention, no matter where you are in your journey, there are things you can do to reduce your future risk. So let me just really reassure you from the beginning that the CDC and research has shown that up to 80% of strokes are preventable through science-based nutrition and lifestyle change. So we can change this. We can change the trajectory of the future as long as we're being proactive. Oftentimes, when someone has a stroke, they are being seen by a neurologist, by a cardiologist, and it's oftentimes confusing. Is this a brain disease? Is this a heart disease? And many times people are not aware that what is actually going on. Before we even begin to explain, of all the connections, I really want to define to you what a stroke is. So, a stroke occurs when the blood supply to part of the brain is interrupted or reduced, which deprives the brain tissue of oxygen and nutrients. And we need to make sure that we are acting fast if you're having any of these symptoms that could be an indication of a stroke. So, face drooping, arm weakness, speech difficulty. We need to act fast. And that means you need to call the ER and get there as soon as possible to help with your recovery. The longer you wait, the more debilitating a stroke can be. And so we must act fast. And so you remember it by that acronym, FAST. It's important that we understand that some people may not have a stroke, but they may have TIAs, transient ischemic attacks that occur. And it might be very quick, and you might not even notice that it happened, but on a CT scan, they can see it. And if you did notice that you had a TIA, that's almost like a warning sign that if you aren't very proactive in your care, it can lead to an increased risk of stroke very soon thereafter. So be sure that if you have TIAs in your past, or you recently had one, that you are really looking at your metabolic metrics and optimizing all of them, especially blood pressure. So why is this preventable? How are strokes preventable? Well, I want to really explain that what the stroke is, but really kind of divide it. There's hemorrhagic strokes and there's ischemic strokes. And today for our topic of conversation, just because this video is not that long, ischemic strokes is what we're really going to be focusing on. If you want to learn more about hemorrhagic strokes, I do mention it in my blog post that you can find on my website at entirelynourished.com. But the reason why I want to talk about ischemic strokes particularly is because it is the most common. 87% of stroke cases are ischemic, and this is the type that is most preventable. This type of stroke is actually caused by a blockage or obstruction in a blood vessel supplying blood to the brain. And many times it's due to atherosclerosis, so plaque buildup or plaque dislodgement that interrupts the ability of the body to supply good blood flow to the brain. It can also be caused by blood clot that happens due to high blood pressure or atrial fibrillation. And so in AFib, if it's not controlled, the blood can pool in the lower chambers of your heart, and that can pump up and it can cause blood clotting, and that can cause it to go straight to your brain and lead to a stroke, which is why AFib is one of the main risk factors for having a stroke if it's not controlled. Same with blood pressure. There are other risk factors that we can manage that will definitely help to also lower the risk of a stroke. And those include things like cholesterol levels, specifically our LDL, our ApoB, really trying to get that LDL less than 70 milligrams per deciliter, your ApoB, depending on your risk profile, less than 80 milligrams per deciliter. We want to make sure that we are optimizing blood pressure to 110 over 70 mmHg. That's the optimal measurement. We also want to make sure we're looking at blood sugar control and inflammation, because this is a vascular disease. The heart attack is when your blood supply to the carotid arteries, your major arteries in your heart are blocked. And when we look at it from a stroke perspective, it's to your brain. So heart disease and stroke are very correlated, especially given that the number one type of stroke, 87%, is ischemic, which is from the heart. But the reason why you're being seen by a neurologist and a cardiologist when you have a stroke is because we need to be looking at both aspects, because it's affecting vascular health and brain health. So let's talk a little bit about prevention here for a minute. So when we talk about prevention, and what I really specialize is looking at all the arms that could increase your risk. So we want to optimize those cardiometabolic risk factors I just mentioned: blood pressure, weight reduction, waist reduction. That's optimal for you. We want to make sure cholesterol, blood sugar, uric acid, inflammation, all of your cardiometabolic risk factors are optimized. They all matter. They all matter for heart health. They all matter for vascular health. They all matter for brain health. And so those need to be optimal. And we do that through lifestyle intervention, and medication is needed. So when we look at a heart healthy diet, we're looking at making sure that it's nutrient sufficient, supplying the vascular system and the brain with nutrients that allow for good blood flow, for allowing for good vascular tension, to allow for opening of the arteries instead of that constriction of the arteries that can lead to these complications. Think things like foods rich in magnesium and calcium and L-arginine and folate, making sure you have adequate amounts of lean protein, adequate amounts of complex carbs and healthy fat, really looking at the balance, the way you're eating and the food pairings, while also acknowledging that there are some foods that can cause more plaque to form and cause more constriction in the arteries and inflammation. So we need to decrease those, specifically things like sodium, saturated fat, trans fat, refined sugars, etc. We really want to be looking at nutrition, looking at exercise from all aspects of resistance training and our aerobic and our stretching, looking at smoking, alcohol cessation, looking at making sure that we are getting regular health checkups to make sure that our blood pressure and our cholesterol and our AFib and everything is under control. I do recommend that everybody check their blood pressure at home and make sure that it is optimal in all settings too, because that is a really big risk factor and we can really easily control it through proper nutrient sufficient nutrition. So make sure that you are acknowledging that this is in your hands to take action, and you can reduce your risk by improving these values. And if you're on medication, we also always want to pair that with nutrition for optimal vascular health. I can't tell you how many people see me in private practice that have been on so many medications and still have a stroke, still have a heart attack, because they never paid attention to their nutrition from a heart health lens. So make sure that you're looking at all aspects so that you can truly reduce your risk of any future cardiovascular complications. If you need more support on these metrics, I would recommend working with a registered dietitian who specializes in heart disease, who can assess your progress, address your challenges, adjust your treatment plans, and make sure that you are looking at everything and really putting all of the pieces together to optimize your heart health, your brain health, your overall well-being, so you can live a long and happy life. Feel free to visit my website. I have a lot of great content on there that may be able to help you. You can sign up to my email list there too. The website's www.entirelynourished.com for more heart disease prevention tips. If you're looking for support on your heart health journey, I would be more than happy to support you. I have one-on-one programs. I have group programs, and I give a lot of complimentary information all over the social media because I really want to help you and I want you to take action. Don't wait. Take one step forward today. So feel free to reach out to me with any questions. I hope this was helpful. I hope this helped you kind of piece a little bit of it together, and I hope it really empowered you to say, you know what? I can do something about it. I'm going to be more proactive. I'm going to be proactive in my care, and I'm going to make sure that I do everything I can to reduce my risk. So, hope this was helpful. Until next time, have a lovely, lovely day, and we'll talk again soon.